A special diet's been developed to help sufferers of irritable bowel syndrome, Australia's most common stomach disorder.
As many as 13 million adults in the U.S. suffer from irritable bowel syndrome with constipation. It's one of 3 major subtypes.
We're talking about IBS, short for irritable bowel syndrome.
Do you suffer from frequent stomach aches, bloating, and changes in your bowel habits? Do these symptoms affect your social life, your family life, and work? You might have irritable bowel syndrome or IBS.
You are not alone. Up to 20% of the global population is suffering from something called irritable bowel syndrome or IBS. Many patients suffering from IBS suffer in silence. The reasons for it is they are either embarrassed to talk about it or they have tried seeking help just to be dismissed, saying all your tests are coming back normal, it's all good, you are just imagining it, or it's all in your head. As a healthcare professional seeing patients with IBS in my clinic, I do encourage you, I plead with you to do not let anybody dismiss you with your symptoms. In this session, we will talk about probiotics. It's a kind of a magic word that everybody's talking about. Most of my patients are looking for probiotics as an intervention to help their symptoms of IBS. And most of the time, those patients, when they are self-selecting a probiotic intervention, do it wrong. They select wrong product or wrong strains for the desired outcome, which leaves them even more frustrated and not willing to even participate in asking for help or engaging with a healthcare professional. In this session, together, we will first understand the difference. What kind of a gut pain is it? IBS. We'll discover the distinguishing features, how to recognize the irritable bowel syndrome or IBS. Secondly, we will look at understand how that IBS is diagnosed. This is something you will do with a healthcare professional help and assistance, but understanding the process of diagnosis of IBS, it's very helpful. We will talk about how you can actually take charge of your IBS. We will talk about harnessing the power of probiotics. This session will be focused on probiotics as intervention. Empowering gut health, you will receive a comprehensive gut checklist or guide how to approach the gut health with knowledge and confidence. We will talk about it. We will teach you how to navigate the system and how to select the most appropriate product or probiotic strain for the desired outcome. So by joining me in this session, we will take a deep dive into the intricacy of IBS and pave the way for a life free from its symptoms. My name is Dragana Skokovic-Sunjic, and by profession, I'm a clinical pharmacist. I've been working as a pharmacist for a long time, and I do currently work in a clinic set. So I work in a primary care and I see patients on a daily basis. I see patients for different reasons, and vast majority of my patients is to do with the gastrointestinal issues, and lots of them do present with the symptoms of IBS or irritable bowel syndrome. And in addition, for the last 15 years, I've been involved in preparing and publishing clinical guide to probiotic product, which is the reference tool or resource for healthcare professionals and patients when they're deciding whether they need a probiotic, and if they need it, what strain to take for a specific reason they like to achieve or symptom to relieve. By definition, IBS is a chronic and it's usually lifelong functional gastrointestinal disorder. It's very prevalent. In North America, 1 in 5 people present with the symptoms of IBS, and most of us will have certain kind of gastrointestinal abdominal issues from time to time. We experience it and it goes away, but with patients with IBS, those symptoms are present, unpredictable, and more dramatic and more affecting quality of life. The typical symptoms of IBS are abdominal pain and discomfort. It doesn't have to be exact pain, but it's something going on all the time. Usually there is abnormal stool frequency. It's either too many bowel movements or not enough. It could be diarrhea, could be constipation, could be also in between, alternating between one or the other. So this unpredictability of symptoms is very frustrating as well. There is most of the time presence of gas and bloating and extension of the gut, of the bowel and the stomach. And these symptoms are associated and made worse by psychological stress. And all of us are stressed on a daily basis. And what is frustrating, we could have a couple of days with no symptoms, and then suddenly they appear with a vengeance, and they kind of leave us crippled. It's quite often patients are told, oh, it's just a bloating and a bit of discomfort, etc. But what we do know is that IBS symptoms affect all aspects of our life. So we do have statistics about affecting the productivity. Loss of productivity with patients with IBS, it's almost double of the loss of productivity in average population, up to obviously more than 30% with IBS patients compared to up to 19% with the average patient without IBS. It's sobering to find out that in US, 13% of the IBS patients are unemployed just because of their symptoms, because they cannot hold a job because of the symptoms. Observed that some of the global surveys found out that 46% of the patients with IBS missed school or work because of the symptoms present. And again, there are different kinds of calculated risks. The data I have is from the pre-COVID. Now it's probably double that amount. That cost direct to the patient and cost to the healthcare combined can be up to $13,000 US annually. So just for a single patient. And that is pre-COVID data. So looking at the dollar value as well, it does add to loss of cost to manage symptoms, to add for the loss of productivity, etc. So globally, IBS is very prevalent. And again, in addition to being such a challenging and functional gastrointestinal disorder, in North America, up to 20% of patients will actually present and have the IBS diagnosed. And it peaks in a second or third decade in life and then eases off as we get older in a 6th or 7th decade of our life. So it's interesting that the symptoms are present when we are the busiest in our life. We have most symptoms. And again, what is also interesting from the perspective of a healthcare professional or somebody involved in healthcare, the patients with the IBS will consume 50% more of the healthcare resources compared to the patients without IBS. So I'm not saying that they are going to doctor more often. It's just the symptoms and complications and mental health issues and other things surrounding the IBS diagnosis and management will actually be more costly for the healthcare system and also more costly for patients. Patients initially, once they're diagnosed, they will seek help. On average, 70% of those patients will get different intervention every time they visit their healthcare provider, being a family doctor, gastroenterologist, naturopath, or somebody else. They'll keep changing interventions, and they can range from changing diet, elimination diets, prescription medications, etc. And quite often, the symptom relief might be temporary or not really satisfactory, and that can add to frustration. That's one part of that cost. So the cost of seeing somebody, cost of doing intervention, and then also cost of taking time off work because of the symptoms and time off to do investigations, different kinds of screening, etc. But what is, I would say, sobering is the impact on quality of life. And it can be very profound and very dramatic. So we know that symptoms are, as I said, nobody will die from bloating and bit of a constipation or diarrhea. But because symptoms are so dramatic and so severe, they affect how we do our daily activities, how we go to work, how we engage in leisure time, how we socialize, how we engage with the family. how we function in those roles. And again, as I say, we miss work, we miss to do things we should be doing because of the presence of symptoms. One of the interesting things is often patients do not get relief with the first couple of interventions, and they stop asking for help. They try to figure it on their own, or in some instances, they don't want to talk about this stool or bowel movement. They're almost embarrassed to talk about it. This kind of topic is considered taboo, so they just don't ask about it. They are almost ashamed to say, oh, I have to go to the washroom right now. I have to drop things that I'm doing and just go there and be there for half an hour because of the pain and discomfort while I'm passing stool. So definitely a frustration on behalf of the patient. They don't feel understood and they suffer in silence. Some of the studies have observed as well that combination of the symptoms presence and changes in bowel habits, the effect on kind of sense of well-being and functioning of the patient can be so dramatic that can actually increase the risk of suicidal behavior in these patients. And increases of this, even thinking about suicide and depression and mental health issues, is extremely significant in IBS patients. I would say something that we definitely need to get involved and do something about it. It cannot be dismissed. One of the colleagues of mine mentioned that IBS is a benign disorder without benign effect. So the symptoms itself are not life-threatening, but can threaten life if they're not treated properly. So the symptoms presence and unpredictability does increase risk of low mood, depression, as I mentioned, suicidal behaviors or alienation. But at the same time, frustration because of the lack of help also can add to this kind of a feeling of abandonment and feeling of really isolation. And what we also observe with patients with IBS, because they've been told they have to eliminate certain foods or food groups or change diet, quite often they develop eating disorders. So snowballs from the initial symptoms to other issues and other complications.